Women's Health Dexeus is a medical department existing for more than 70 years now in the context of a general hospital affiliated to the Autonomous University of Barcelona. In our department, we covered women's health in a comprehensive manner because we take care of the health of our patients in the three different fields. In obstetrics, with taking care of fetal-maternal medicine, in gynecology, and in reproductive medicine as well.
Assisted reproductive techniques will involve a more individualized treatment of the patients. We will have specific treatments for every patient that we treat. Another important issue is that we will have, and we have already now, new indications for assisted reproduction techniques, such as fertility preservation, not only for medical but also for social reasons. And the future, and this is a real future, is the use of artificial gametes. Gametes that can be produced with the use of stem cells, and that can be used in patients where no oocytes or sperm can be found.
When a couple decides to go abroad for medical treatment, I think that they should take their decision based on which country to go, based on different aspects. First is location and transport connections. Second, it's also important the weather conditions, touristic aspects that are also important. But above all, I think that the most important points are the legal situation and technical facilities that they can receive in this country. When they have to select a clinic, I think that their choice must be based on the experience of the clinic and its reputation. This is important. The efficiency, patients must know the results that this clinic has in the treatment they are going to receive. And then the couple and the infertile couple must feel comfortable when having the treatment. And this is why, for us, friendliness is something which we consider crucial to offer to these patients coming from abroad.
When international patients come here, we receive them at the reception. We give the patients all the information about the medication, about the exams they have to perform, and also about the hotels here in Barcelona, because it's very important for them to know where to stay then for the treatment. Our main purpose is to make the whole process easy for the patients. That's why there are 8 people working in the international department, speaking English, French, Italian, German and Russian. We accompany them to the visit with the doctor, and then we leave them with the doctor, as normally the doctor speaks perfect English. So after the visit with the doctor, we give them all the instruction and all the receipts and advices they need to carry on their treatment. For example, maybe they could need something about their accommodation here in Barcelona. We give advices about that. Or during the treatment, if they have any needs, any question about any pills or medicaments they need to take, we will just give them all the information about that after having talked with the doctor. We're not just a translation service. We assigned every patient a coordinator that will take care of her needs during the whole treatment.
We consider that a couple suffers from infertility when they have difficulties in achieving a pregnancy after 1 year of sexual relationships without contraception. We have to consider that human fertility is poor, and the human beings, we are those with the lowest fertility among the animal kingdom. And naturally, the chances of achieving a pregnancy in a given month are no more than 20–25%. And this is an important message to give to the patients. Thanks to the new assisted reproductive technologies, we can largely exceed these figures and according to different situations in terms of the age of the patients, of the infertility factor, we can almost double this figure and reach 40–45% chance of achieving a pregnancy in a given month.
The process of diagnosis of infertility starts, as always in medicine, with a good medical history. We have to ask both partners of the couple about previous infections, previous diseases, surgeries, if they have had exposure to toxins or gonadotoxic treatments. Regarding the woman, if there's a family history of premature menopause, this is the first step. Once we have done the medical history, we have to explain patients that infertility is not only a problem of the woman, so it's a problem of the woman and of the man. And sometimes there's a mixture of both a female and male factor, and in as far as 25% of cases, the problem remains unknown. But still, we have to start with a fertility checkup in both the woman and the man. In the woman, this checkup includes assessment of the ovarian reserve status, and this means we have to do an ultrasound scan to see her antral follicle count and hormone test. Especially important is the anti-Mullerian hormone. It includes an ultrasound to check as well the uterine cavity and the ovaries, so we have to rule out the presence of ovarian cysts or uterine fibroids or malformations. This could also be examined with an office hysteroscopy, and lastly we have to check the fallopian tubes as well with a hysterosalpingography or hysterosalpingography. Regarding the man, the first step is to do a sperm analysis. And this will give us information of the sperm count, the vitality, the motility, and the morphology. If 2 sperm tests are abnormal, then we should send the man to the specialist who is the andrologist to see if further tests are needed.
In this field, in reproductive medicine, we have been pioneers for the last 30 years. In Spain, in Latin America, we have been the first center in achieving results with assisted reproductive technologies. If you need some medical help to have a baby, come to Spain, come to Barcelona and to Women's Health Dexeus. Here we are able to assist you, and we will be delighted in helping you to have a child.